Before we kickstart, as I said, your input is very valuable, but I'd like to share something that was very important for me for today. This year, 2024, the 14th International Workshop on Women and HIV will be held. But this year, in 2024, it is the first African workshop on HIV, on women and HIV. So I'd like to really start by saying thank you to ViV Healthcare, thank you to the sponsor, thank you to the endorsers, and thank you to everyone who has come together to realize that it is definitely not a one-glove-fits-all. African women have a voice, and African women need to come together to make sure that their voice is heard. So, before I hand over to Michelle, our next speaker, I'd like everyone just to take a few minutes to watch this video. It's two videos that are back to back, but it's videos that are sharing the experiences of people who have literally gone through what the benefits are of U equals U. They may share their challenges, but hear from the voices of those who say, U equals U has meant this for me.
– 112,000 instances of condomless sex with 0 HIV transmissions. Share the happy message of U equals U today.
A person living with HIV can achieve an undetectable level of HIV by getting on effective treatment and staying on it. It typically takes 1 to 6 months after a person starts treatment to reach undetectable levels, and then an additional 6 months to make sure their treatment is keeping their HIV undetectable.
The science of it and the policy of U equals U was actually born in the Swiss statement, but they said that people on treatment did not transmit. That was met with skepticism and fear, really, by doctors and by patients and by people in the community, regardless of their HIV status. The data is incredibly robust. It comes from multiple continents now around the world, and again, represents many hundreds of thousands of studied sexual encounters where body fluids are exchanged and condoms are not used.
I was with a partner who was not positive, and there were things that happened, and he did not turn up positive, and we were like, I was certain he was going to. So when he went and got tested, I was like, oh, well, you know, I'm not transmitting. How is that possible? So I sort of knew, but I didn't have a name for it.
What do you think we need to do next?
What needs to be done is inclusiveness. Those people who have been left behind, bring them in. Let them come and also give them the education on what U equals U means. There's women. There's also newly diagnosed people who don't know the meaning of U equals U. So let's bring the whole village together.
This needs to be like in actual everyday things that people see or read or whatever, for it to actually be heard and understood. If it was on the news, that would reach so many more people. It's not, and that's a problem.
So good afternoon to those of you in the room, and for those of you who are joining virtually, good morning, good evening, or whatever time zone applies to you. Thank you, Sibongile, for setting this up, and I also want to echo your thank you for this workshop, which I feel is really long overdue for us to hear about African women and their experiences with HIV. Now, as Sibongile mentioned, I'll be talking about some of the data about U equals U very, very briefly, and then we'll be opening up for a massively big, hopefully very interactive dialogue with all of you. And not to forget, those of you who are online, please do post your comments and questions as well. You can post anonymously, but you'll need to do this by specifically selecting that you want to post anonymously, otherwise your name will also be posted. So before I start off with the data, I would love to know, by show of hands in the room here, who of you have actually heard of U equals U before you saw announcements about this session? Okay, fantastic. So that's, I think almost every hand went up, and that's really good to know. So then let's look a little bit at the data. Now, the data around U equals U, as Ben said in the video, are really pretty comprehensive and robust. There was a review published in The Lancet last year, which looked across 8 studies involving almost 8,000 couples across 25 countries in over 5 years. And during that time, across those studies, there were absolutely 0 cases of HIV sexual transmission. There was a subset of this review, or subset of the studies, which actually showed that there were more than 160,000 unprotected sex acts between 0 different couples, and this included heterosexual as well as same-sex male couples. And again, we saw 0 transmissions there. And also importantly, when it comes to U equals U, the risk of vertical transmission is less than 1% when undetectable viral load is present. So major guidelines actually agree, and last year WHO issued a guidance document talking about U equals U. There are other guidelines that have also done so, but I think very importantly that we look to the WHO guidelines, and it said quite categorically that people living with HIV who have an undetectable viral load have 0 risk of transmitting HIV to their sexual partners. And they even looked at less than 1,000 copies per milliliter viral load, so looking at people who are suppressed but not necessarily undetectable, and even there the risk of transmission is almost 0. And as I mentioned, when it comes to vertical transmission, there you can see that when the viral load is undetectable, the risk is less than 1%, so very, very low. And in fact, as you know, the World Health Organization endorses breast or chest feeding for people living with HIV with babies. I think just also to point out, when it comes to undetectable, it really doesn't matter which test you are using, which specimen, so whether you are using a viral load or whether you're using a dry blood spot. And the reason I'm bringing this up is because it was felt, or there's been a lot of confusion, that if you are somewhere where plasma viral load testing is not available, does U equals U actually apply? And if you are using a WHO-approved test, as I say, it doesn't matter what the specimen is, whether it's plasma, whether it's a dried blood spot, it doesn't matter what the limit of detection of that test is. If you are undetectable on that test, and it's a WHO-approved test, U equals U does apply. So I think this is really amazing and fantastic news. So I think for most people with HIV, the message of U equals U, it should be empowering, it should be destigmatizing, it should be revolutionary and life-changing. But I think, as you'll see when we move on to the discussion later, this is not necessarily the case for all people living with HIV. Now, there was a study done, the Positive Perspective study in 2019, which was a survey done in 25 countries involving almost 2,500 people living with HIV on treatment. And what it actually showed, that for those people who were informed by their healthcare providers about U equals U, they experienced optimal overall mental, physical, and sexual health, as well as improved adherence to their regimen, which of course leads to better rates of viral suppression. They felt more comfortable disclosing their HIV status, and also more comfortable discussing health concerns with their healthcare providers. Okay, so going sort of back to summarizing our message, first of all, I think what I wanted to say is we did put out a flyer, and I think there's been some hashtags on social media around U equals U, encouraging you to wear your best U equals U rags and stickers and badges. And I want to acknowledge the stunning U equals U t-shirt from the amazing Angelina. And please support her with her t-shirts and, of course, her message. And so I hope that some of you have got those. And we did put out stickers, so you can put those on your bags or on your arm or on your laptop or wherever. But I think just the key message for the last time from me is that when a person living with HIV has an undetectable viral load, they will not transmit HIV to their partners, their sexual partners, and their risk of transmission via vertical transmission is almost zero as well. So with that, that's enough from me. I actually want to throw something out to Doreen. I want to ask you a question as a representative of the community. What is your perspective or the broader community's perspective around U equals U and the experience of that?
Hello, everyone. Doreen Moracha is my name. I'm a young woman living with HIV. I've lived with HIV for 31 years now and been on treatment for 19 of those years. So to me, U equals U is a science that changes how we view HIV in 2024. Because how many of us remember when HIV was a death sentence? Well, a good number. And have things changed now, or are they still the same? They have changed. So are we making progress? Exactly. So because we are making progress, part of our progress equals U equals U, the science around it. And I want you guys to applaud the communities of people living with HIV, because without them being on treatment, without them committing to living a life beyond their diagnosis, we wouldn't have this beautiful science of U equals U. So just one round of applause for them. Thank you so much. That is for us community members, because we commit every day to taking treatment. We wake up every day and we choose life, and we want to change the face of HIV and show the progress that, hey, we have this beautiful science, but it won't work if we're not taking treatment. And part of the experiences, because when I was diagnosed with HIV, there was no treatment. It was just go home, love her, take care of her. In case treatment comes, then fine. But 5 years later, I started treatment. And that time, we still did not have U equals U. It was just taking treatment every day just to maintain the viral load at the CD4 count. And now, I think from 2018 is when I was told about U equals U. And I was like, okay, that is new. And then it didn't seem believable. It seemed a little bit like we are used to HIV being highly transmittable, people living with HIV being given all these precautions. But now we have that confidence that, hey, I am living with HIV, but I don't care if what other people see of me, because I'm undetectable. And that just boosts your confidence in a different type of way, because you know that it's not just about you being labeled to be HIV positive, but you know your viral load is low, you cannot transmit HIV, women are able to give birth to HIV negative children, you can date a HIV negative partner. I was born in a discordant relationship. So that is something I would want to see for myself. And with U equals U, it means I'm enabled that, hey, there is science backing this, and there is me as a person taking my treatment, and that, I think, makes this whole journey very beautiful.
Thank you very much, Doreen. That was really important, what you said. I'd like to follow on with another question, and then I'm going to ask the audience a similar question. So from everything that we've heard, from the video, from people talking, and from what you've just said, U equals U appears to be a very affirming and positive thing. And I think that most people would agree with that. But we also hear that U equals U may pose a challenge for some women. and particularly women who, for example, are in sero-different relationships, either where they themselves are not living with HIV and their partner is, or where they are living with HIV and their partner is not. So if we speak, first of all, about women who are living with HIV with a seronegative partner, one of the things that very often happens, particularly where the partner doesn't know about U equals U, is that they will use condoms. But I've heard, and a lot of people have said the same, that when the seronegative partner male partner hears about U equals U, he says, well, I don't feel that I need to use condoms anymore because I know that there is no risk of you transmitting HIV to me. But actually, many of those women like to use condoms, want to use condoms because they are aware that their partner has partners outside of their relationship. And so their using condoms is not to protect their partner from HIV because they know that U equals U applies because they have a negative viral, undetectable viral load. They use condoms because they want to protect themselves from STIs. And so generally condoms have been considered to be tools that disempower women. But in the context of U equals U, actually, they may be tools that empower women. And I wanted to know what you thought about that and whether you have heard similar things.
Thank you so much, Neka. So, to me, U equals U is affirming to the person living with HIV. They know that they cannot transmit HIV. But unfortunately, if I have a negative partner, I am not very sure if they are faithful to me. Because I remember in Kenya, we used to have the campaign of ABC, abstain, be faithful, use a condom. So if the partner is being faithful and I'm undetectable, then I know that I am prevented from, let's say, STIs, unless we're preventing pregnancy, which is a different dynamic. But now, if I am not sure about my partner, and I know very well that I am undetectable, I will not transmit to them. But I don't know about them. Maybe they will get another HIV infection, reinfect me, then what happens to me? It puts my life at risk. So it is affirming to the partner taking treatment. It might be not so much affirming to the partner who is HIV negative, because if they have other partners, then that puts me at risk. But if we are being faithful, we are combining it, because earlier on we spoke about the aspect of choice. If we are combining HIV and condoms, then I'm safe, I am good, I'm affirmed that everything is fine. But if we are using U equals U only, and there's the aspect of unfaithfulness, and there is, it's giving a gray area. And ideally, U equals U is based on giving me the reassurance that I won't transmit to my partner. But when it comes to other STIs, which ideally people living with HIV are very susceptible to, it does not give me that confidence. So U equals U only applies to HIV. So other STIs means another HIV prevention method, and that takes us back to the basket of choice that we have that exists actually, and we can always use another choice. Yeah.
Thank you. That's very clear. Something else that has come up is the issue in the opposite direction. That there's quite a lot of data now that shows that U equals U has been a means to encourage men to test for HIV where they might not have done so in the past. And so some of these men are then finding out that they're living with HIV and start treatment. And those men, once they become undetectable, once they have an undetectable viral load, may insist on not using condoms with their partners. And there have been reports of increased rates of gender-based violence in these circumstances. And I wondered whether this is something that you in the audience have heard of, and whether anybody would like to comment. Don't be shy.
I'm actually going to be very, very strict. There's a beautiful hand that's been raised there. And whilst we go to the hand there, can I ask if the question asked by Neka, I'm seeing a few males in the room. I'm going to pick that. Can a man respond to Neka's question?
Okay, well, maybe while a man is thinking, we'll go to microphone number 2. Is it 2? Over there. Yeah. 2 and then 4.
I want to share my experience. In 2020, we ran a phone interview during the COVID period among discordant couples. And what you'll notice that women who were seronegative in these discordant couples had higher rates of sexual gender violence as compared to seropositive women in their relationships. And it's quite interesting because I think it's more to the bargaining power. Yeah, and they're a bit more vulnerable and the like. Yeah, so, and then I also wanted to talk about, and they sometimes have very good reasons, because they worry about the adherency of the partners. So I think you equals you should be talked about in terms of adherency, especially for the male partners. That was what we found out in 2020 at AIDS Information Center.
Thanks very much. That's really helpful. Number 4.
Thank you for giving me the opportunity. I am Kisabei Phyllis. I
We
work
can't
at
hear you.
Kenyatta National Hospital. So for me, you and you is equals to you is not possible where there is gender-based violence. Because if there is violence, there is no way that person will remember to take drugs. And even the sexual intercourse is not safe because they are going to be bruises, so chances of that person getting infected are high, and the person is not safe mentally, so they may not remember their treatment. I would like to remember this in 2007, 2008, when there was post-election violence in Kenya. While working at the Comprehensive Care Center, most of our clients did not have their treatment. They did not even remember. They were not safe. They are worried more of their lives, and there is more likely to be sexual abuse. Because when there is violence, when there is instability, human beings just tend to want to take advantage sexually of others. So if you is equals to you is not possible in a situation where there is gender-based violence.
Thank you. Very powerful. And I think in the session earlier on mental health, there was a similar discussion about people who are experiencing, who have mental health problems, finding it difficult to be adherent to treatment, and then the risk of compromising their viral load. So thank you very much for that. Number 3.
Yes, thank you so much for this opportunity. And I would like to give a comment on that. As a man and a health professional, we've really seen it happening. And the truth is, it is hard for you equals you to work in families or in relationships where we have gender-based violence. One, you realize if it is a male who is abusing a female, you realize a number of things happen. One, a female will even forget taking the drugs. And what happens, we also tantamounting, really risking the lead. The viral load again increasing, and the end result will be also a problem to the lady. And 2, it also increases, gender-based violence also increases on mental health. And whenever we see stress coming in and again depression coming in, it also tantamounts the immunity to this lady here, and again becomes a very big challenge. And in such a situation, you realize you equals you will not really work. And what are we supposed to be doing? We need also to involve, like we've already said, we need to bring men on board. At times they get this information on peripherals. They are getting this from maybe the partner, not from the person who would really explain to them and understand it from the point of view of understanding this you equals to you. And therefore, earlier on we discussed about the patriarchal kind of settings in Africa. a lady does not really talk sense. That is what some of us still believe. And therefore, I may not really take it important as they say. And therefore, it may not really work. But the other way around, if we bring men on board, definitely this will be a very good initiative and it will work very well. Thank you so much.
Thank you. So I'm going to go to microphone 3, but I'd like you all to think about the question that I'm going to ask next, which is, I think, this issue of bringing men on board is really important, and thank you very much. And so, what we're trying to do in this session is to think about some of the challenges that women may experience with regard to U equals U. But what we really want to go away from this session with is potential solutions. So I'd like to hear, and we would like to hear from people who've been successful in engaging men in conversations about U equals U or about the sexual and reproductive health of women, because it's critical that men are involved in this. So number 3.
My name is Levi. I represent the key population, and I'm a living testimony. U equals to U works, because I'm a man, MSM, living with HIV. I'm dating somebody who is HIV negative for 10 years. Hallelujah. U equals to U is a game changer, because this knowledge promotes healthy attitudes about sex, relationships among the key populations. It encourages open communications, and we freely talk about our HIV status with no fear. So to men, I don't know, but I personally, I just feel we need to unpack maybe if it is the messages, in a way our men can understand what U equals to U is. Bwana asifiwe.
Thank you. Thank you very much. I'll go to number 4, and then I'll come to...
Thank you very much. And to respond to your question about solutions, and not that I have direct experience in terms of solutions, but I do have a lot of experience in the fight against HIV. And my sense is that we all acknowledge the relationship between gender-based violence and HIV. But now we're trying to address gender-based violence kind of like as a stepchild, as a, as a side issue while we're addressing HIV. And yet we have all of the armamentarium, we have the experience, we have the infrastructure of dealing with HIV. So in terms of solutions, I'm saying yes, bringing men on board is one of the solutions. But key to it is using the very same armamentarium, the very same infrastructure, etc., that we used to deal with HIV. When I graduated in medical school, in that year, 2 women in my class that we graduated with, immediately after graduating, it made headlines in South Africa. They were killed by their husbands or partners. So gender-based violence is a big thing, and we have a cascade approach to deal with HIV that we have seen work. Everyone, globally, they know. We have the targets, we have timelines, and we have the approaches, we have the infrastructure, we have the experience. Let's bring gender-based violence front and center, not as a stepchild, front and center, and say, with all the experience that we have, with all the infrastructure that we have, let us deal with this thing head on.
Thank you. Yeah, truly, very, very powerful and very, very important. Because in a sense, HIV is not the problem. We can deal with HIV. It's the gender-based violence that's the problem. And it's a problem that exists all around the world that isn't really being tackled the way that it should. So thank you very much for that. Number 2.
All right, thank you. Speaking still more on the solution, I think the conversation of U equals to U should be taken way beyond the HIV space. So most times when we talk of U equals to U, we usually want to have this conversation within the HIV space. And that does not give enough room for other persons that don't have anything connected to HIV intervention to get to know about U equals to U. Now, these are the people that most times will get to be involved with maybe a partner that is HIV positive, and then getting to know that they're HIV positive, it's kind of reacting, and then the increase of gender-based violence, stigma, and discrimination. So for me, one way to go is to have this conversation way outside the HIV space to get a lot of persons getting to know about U equals to U. That can also help to reduce the GPV related to HIV.
Thank you, very important. These conversations should be happening in the general population, because one of the reasons that some of the stigma that exists with regard to HIV persists is because people don't know about U equals U and are afraid. And so you're right, these conversations should go far beyond just the HIV space and into the general population. Thank you. Number 3.
So thank you very much. So I worked for several years in the HIV space, and I had a young lady who had just had her first child, and we diagnosed her with HIV infection. She told her husband. The next thing was the husband initially, after we counseled him, promised and everything, we tested him. He wasn't faithful himself, but he was lucky. He was not infected. So the next thing was he went to meet the pastor that joined him to the lady, that this lady is HIV infected. He wanted a divorce. He went to tell his landlord. The lady was not allowed to go into the house. At the end of the day, the lady committed suicide and she died. And everybody thought, yes, she knew she had HIV. Why didn't she tell the man? You know? I believe that U equals U will reduce that. Because if people, like the last speaker said, I think it just echoed what I have in my mind. We need to say it not in this community, outside. The general population needs to hear that you can have HIV and not transmit it. And then they feel safe. Then the families feel safe that, okay, because it's like, if they think you can transmit it, they think it's a death sentence. You want to kill them. So that's why gender-based violence comes in. I said, before you kill me, I will kill you. So I think we need to go out. More mobilization and community awareness will also reduce gender-based violence.
Thank you very much. Number 4.
Good evening. My name is Wendy. I work with Bar Hostess and Empowerment Support Program. So for U is equals to U, I feel like it's the grassroots problem from the community-wise. If we get to sensitize the community level, because right now, not everyone is here. We are like 10% who are here. The communities are suffering. So we do not, when you get to understand what's coming from the grassroots, from down deep, then you'll get to be able to sensitize the community, and to U is equals to U. We are using, they're called, I don't know their names, I've forgotten them. The pamphlets that normally are given into the facilities, right? This one spread the information to the community, but after that, what information is it being given? Because when I pass information to the one who I'm sitting with right now, I'll pass it differently. So whatever he or she has read from the book, or whatever the facility is offering, how has he or she passed it to the community? Gender-based violence, until we get to understand it from the community level, because it's not a matter of illiteracy, it's not a matter of ignorance, but how are you handling it from the community level so that it can be sensitized and you can get the problem, the grassroots problem that is coming from there.
Thank you. So Doreen, I'll come to number 3 in a second, but we spoke about this earlier, Doreen, the importance of involving the community and engaging the community. And I wondered if you might have something to add.
So the importance of involving the community is the message does not end in this room. The message goes outside this room. to the people that we work with, to the communities that we work with. And also the messaging. I feel we talked about the messaging and ensuring that there is a uniform way of communicating U equals U. So that what I understand is not what Michelle understands, and I'm just telling her that if we just put it as simple as, if this person is undetectable, they cannot give you HIV. It's just that simple. But sometimes you find that the language, especially when it comes to the healthcare worker side of things change. So when things change, then confusion kicks in. When confusion kicks in, we keep on wondering, is this U equals U a real thing? Is it working? Is it for rich people? Because there are people who believe that it's for people who are rich and they're taking their treatment and they can afford life, and that is why their U equals U. So have we addressed the other barriers around U equals U, such as socioeconomic barriers that go beyond just taking a pill? Because I'll tell you, I'm taking 1 pill a day, but somebody is going to be like, apart from your pills, what else do you take? And you have to tell them nothing else. It's just the ARV. So as a community person, what you learn about U equals U, it's just very simple. Person living with HIV with an undetectable viral load cannot transmit HIV to their partner. The why is taking the ARV. It's just that simple. So as long as we do not complicate the communication, I feel like we can reach the general population. We can make everyone, U equals U everyone's business. I think that is the gap that we are yet to reach, making U equals U everyone's business. Because the other day I asked people on my TikTok, would you date a HIV positive partner? Some of them were like, yes, I don't mind. Some of them were like, in fact, okay, let me ask the question how I asked it, because it was problematic. I asked it, are you mature enough to date a HIV positive partner? Some of them were like, I have not matured. The others were like, yeah, I'm good, I can date. So you see, when you also have those thought-provoking conversations in church, in women groups, in men groups, in the bar, when you have those thought-provoking conversations, you are not gatekeeping the information. So if we keep the information to only people living with HIV, it's only us who will know it. And then they will start thinking we are campaigning for our own selves. So spread the information as well. Yeah.
Thank you. And so, yes, on the subject of gatekeeping, I mean, I think first of all, the thing that you said that was really, really important is that the message should be simple. And I think, and the message should be simple, coming from healthcare professionals and coming from community. And the messages from both those groups, I believe, should be the same, because there's a lot of confusion around U equals U and what it means. And so I think we really do need to be sure that we are communicating messages in the right way. And that, you know, healthcare professionals, unfortunately, sometimes do behave as if they're gatekeepers of this information. And they decide who they think is okay to share this information with and who they think is not okay to share this information with. And that is, to me, wrong and paternalistic. Everybody should have access to the same information if it is true and if it is positive and if it can change your life. And I really like what the gentleman over there said about U equals U being a game changer. Let's make it a game changer for women too, because, you know, that's who we're talking about, who have some of the biggest challenges for U equals U. Number 3.
Okay, thank you so much. This is Irene from Walter Reed Project Kisumu. In the spirit of finding solutions or alternative towards U equals to U, I want to address another group, the adolescents and the young women. During earlier presentations, we realized that there is still the highest new infections is among that particular group. And we realized that viral suppression is not really good in that group. And now there is the question, why is viral suppression not achieved in that particular group? One of the delegates has talked about fathers being the key decision makers. In an African setup to date, most of the families, the male, actually they have the voice in the family unit. So this brings me to my possible solution. While involving the community, while we are involving the men, can we consider the family unit? Can we address the family as a unit? So that our adolescents, our young girls and boys who acquire HIV in the process are free to adhere to treatment. so that one, they have viral suppression, which eventually will lead to undetectable levels of virus in their blood. So if we address the family unit, also we have a safe space. We talk to this family as a unit, and we tell the parents that U equals to U is a possible thing, and they don't have to, like the fathers, since they are the sole decision makers in these family units, they don't have to actually give these young children hard time, because some of them are afraid some of them are afraid to attend clinics because they fear what their parents will do or will tell to them. So when they are safe in their family unit, they are safe from home, they are safe in the community, then they can safely come for medication and the arts, and they are able to have their viral load low and eventually achieve the U equals to U. So let's also think of the family unit.
Very important. Thank you very much. Before I go to the room, Sib, are there any questions or comments online?
It's actually a very interesting comment that I'd like to highlight and remind everybody about our award-winning speaker, Nozibele, who spoke earlier on this morning about her story of Syro-discordant couple. Online, there's a comment here that says, my ex and I were together for 10 years as a discordant couple. And because of U equals U, he remains HIV negative, and he has never once used PrEP. Indeed, U equals U is a proven fact, and that is a plus in terms of a comment shared by someone who has the experience thereof. But before we move on, I will just ask Neka if we can address this one first as we finish this round. There is a question that I'd like you to take on. The question is, can U equals U be a cure in disguise?
It's a good question. I think the answer is no, because we know that even if people have an undetectable viral load, even for a very long time, that there is still virus hidden away. And that the majority of people, if they were to stop taking their treatment, would find that their viral load would come back, would become detectable again. And so U equals U is not a cure because antiretroviral therapy at the moment does not eliminate the virus. There's a lot of research going towards trying to do that, but we're not there yet. But thank you for the question. It's a really important. And Doreen would like to say something.
I am saying this because I recently joined the HIV Cure Academy, and one of the misconceptions around the HIV cure is U equals U, that we've even seen people go to herbal medication and religious leaders, and they're prayed for, viral load is low, and they believe they're cured, but they're not cured. It's just the ARVs are working. Let's say U equals U means your ARVs are working, so don't stop taking them. Yeah.
Very clear. Thank you. So now I'm completely lost as to who's next. Two.
One of the ways that we can say we are definitely making progress, but at the same time, I'm wondering if we are missing something, because each time we celebrate a win, there's always the issue about bringing the men on board. And this has been a discussion for 2 decades. We are always saying bring the men on board. So the question I have is, are we missing something? How come we always make 10 steps forward, and then when we get there, we look back and say, where are the men? Because we make progress and they undo the gains that we have made. So I'm wondering, even in the planning of this great workshop, was that a consideration about meaningful involvement of men? For example, instead of asking if a man here can share their experiences, would it have been real to get men who have actually, for example, experienced U equals U, or have been able to overcome gender-based violence, maybe they were dealing with that. Is it possible to bring men on board meaningfully so that we don't sit here, for example, and we are looking for a real story from a man, and these men are actually there? If we were intentional, for example, in the planning, would bring real people with real experiences, and they can share that with us, and we can be able to learn from them. So the question I have is, are we missing something?
Thank you very much. And I'm smiling because my colleagues will tell you, if you were to ask them, that when we started thinking about this symposium, the title of the symposium was going to be called Where Are the Men? The reason that we weren't able to do that is because there wasn't a lot of time between us knowing that we were going to do the symposium and it happening. But it is definitely a potential subject for another symposium, and I really commend you for raising that, because it is definitely something that we're thinking about. So thank you. So I'm going to go to the back of the room because I feel that the people at the back of the room have been neglected. So number 4.
Good evening, everyone. My name is Patricia Acero. I'm the chairperson of the International Community of Women Living with HIV, the Kenya chapter. I'm also a board member in the East African chapter, and I'm the executive director of Ringa Women. When I hear of U is equals U, I look at it very broadly. I think sometimes that is what we are missing. I look at U is equals U as a motivating factor. You know, initially when we started taking treatment, we had different motivating factors to take our medication. And some of us were very sick. We wanted our children to grow up. But right now, we have a very big motivating factor, and that is U is equals to U. It can be used to strengthen adherence. 2, it's a prevention tool. When I look at U is equals U, I see a prevention tool. Because if people living with HIV are able to take their medication, then we are talking about transmission rates going down as much as possible, because new infections only come from people who are living with HIV. I see it as well as a prevention tool that can then be put out there among the combination prevention that we have, that this is a tool that we are using. The fact that it's a motivator and an objective for people living with HIV, but also now a tool for prevention, that we need to see how to package it and to bring it across, so that when we are saying that U is equals U should be everybody's business, then we bring it out as a tool. And we need to really look for people who can do the messaging well, so that we sell it. We've known for a long time that treatment is prevention, for a long, long time. But now that the science has been, there's been research and the science is out very clear, we need to see how to use U is equals U very clearly. The third component is about children. That is where the information is not coming out very clearly. Most of the time we are told that you cannot infect your sexual partner. What about my child? Okay? Because I know that I was virally suppressed, I did everything, and I have a child who is negative. And I thought that was U is equals U. Because if I didn't have, if the viral load was very down, it was undetectable, then I was not able to pass it to the child. So that one is information that is lacking, that women need to get to understand that is it okay? That is U is equals U, I will not be able to infect my child. That is the information that we need to find out to be packaged well for the women, because that component is lacking. Then as Doreen had said, that there's a lot of confusion. When you're talking about treatment, we say that if you have a viral load of 1,000, then you are undetectable. But when we're talking about U is equals U, what is the viral load are we talking about? Are we talking about 50? Are we talking about 20? That really need to be clarified. What exactly are we talking about? Is it the 100, the 1,000 that we talk about when it comes to treatment, or is it 50? So when I say I'm undetectable, am I talking about 50? Am I talking about 20? Those are information that we need clarity on, so that when we are talking about U is equals U, we're able to talk with substance and a greater understanding. Thank you.
Thank you. That's really important. Michelle.
Thank you. Actually, I wanted to just pick up on some of the things that you just mentioned, and particularly where you talk about U equals U as a motivator. And I think for so long, it's been with people living with HIV, we've tended to use a stick approach, as in if you don't take your ARVs, your viral load is going to go high, your CD4 is going to come down, and you're going to die. And I think using U equals U is actually instead offering somebody a carrot rather than a stick approach. And I really think that's a much better way of trying to ask somebody to do something as difficult as taking a pill every day for the rest of your life. Just in terms of some of the other questions that you raise, I mean, really, when somebody is virologically suppressed, the risk of transmitting to the child is ever so low. It's less than 1%. And where those transmissions happen, there's usually a reason for it. For example, a late diagnosis, late starting treatment, not achieving a viral suppression, or otherwise we know that actually a lot of the transmissions that happen now to a child actually occur during the breastfeeding period. And we know that breastfeeding can be a challenging time in terms of adherence. And then to your question about, well, what viral load is important, I think you mentioned the viral load of 1,000. Now, a viral load of 1,000 is not undetectable. It is less than 1,000 is suppressed, but it's not necessarily undetectable. But I just want to come back to that message of actually for undetectable, the real number does not matter. What matters is the test a WHO approved test? And if the answer to that is yes, if that test says you are undetectable, then you are undetectable and you cannot transmit. So you don't need to know if the number is 200, if it's 50, if it's 20. So please, I hope that that provides some assurance and some clarity around that. But again, I want to thank you for the motivator comment, because I really think it's good to give people carrots and rewards rather than beating them with sticks to help them to achieve adherence.
Thank you, Michelle. Number 1.
Thank you. I am Miriam. I hope you can hear me. The U equals to U, according to me, yes, it's a motivating factor. But then again, I think we really need to ensure that really people understand what U equals U mean, especially people who are HIV negative. Because now when maybe you're disclosing to your partner and then telling them about U equals U, they feel like it's an instrument for seeking sympathy, or maybe you're looking for a reason as to why I should continue to stay with you. You know, so I think even for that, we should really ensure that we are talking about U equals U every day, and it is not just U equals U, a poster being done in a health facility, and yet that message is not given to the community. It is a motivation, but then again, we really need to understand that the people who are not living with HIV are not taking it as we are, you understand? So that the information is not left with us who are doing advocacy or who we are living with HIV. You know, it must go beyond us, so that we don't have to put people in a situation where they're being exposed to gender-based violence, as we have mentioned. Yeah, thank you.
Thank you. So that goes back, I think, to what Doreen said earlier about U equals U being everybody's responsibility. Thank you very much for that comment. Number 3.
Leka, sorry, may I just interrupt before we move on to the next one? I've got a very interesting question which highlights what Doreen said around the myths and the misconceptions around U equals U. So the question online is, can you please clarify, when a person is undetectable, does this mean that they cannot be reinfected or they can be reinfected with HIV?
That is also a very good question. And there's a lot of concern and worry about reinfection. But actually, reinfection is very, very rare. So what generally happens if you're on treatment is if you were to have sex with somebody who did not have a suppressed viral load, what would generally happen is that any virus from that person that got into you would be suppressed by your own treatment. And when you look at the literature, when you look at all the studies that have been published, the numbers of people who have developed what is called superinfection, so caught another infection are really, really rare. So I want to say in this room that people should not be worried about superinfection. And using a condom where you have an undetectable viral load is not necessary to prevent superinfection. The only reason to use a condom when you have an undetectable viral load is to protect you or your sexual partner from STIs. U equals U applies to HIV, condoms apply to STIs in relation to an undetectable viral load. And I think it's really important that people understand that. Where was I going? 3.
Thank you so much. My name is Isaac, representing Youth Advisory Champions for Health, Kiambu, Kenya. Now, in regards to the need to revolutionize this conversation on U equals U, I've been thinking about how best can we increase the adoption of U equals U conversion within our communities. How best can we just make it more embraceable within our community? About 2 days ago, in a certain workshop somewhere, and we were able to ask about 16 people the same question that Doreen asked online, that who will be comfortable dating an HIV positive person. So out of these 16 people, only 3 were comfortable. So my focus was on the 13. That was when we wanted to just begin this conversation just right there. So our question was, what's stopping you? Of course, 12 of them were shy and they were not so confident of what's stopping them, but one person just spoke and said, I don't want to risk knowingly. At least I should risk unknowingly. So the question was, how do we increase the confidence level? How do we push the confidence level in this U equals U conversation? Thank you.
Thank you, and it's a good question, and I think it's a question that we should maybe ask people in the audience. So what I'll do is I'll go to the people who have their hands up, but can somebody in the audience think about how to answer that question? I think number 2.
Good evening. So I won't respond to that. Maybe in relation to what she had raised, what steps are we moving in relation to U is to U? So responding to that, the other day at the facility I was having discordant couples, whereby most of them were PMTCT mothers. So a big number positive are the ladies. So men accompany them. So after the psychosocial meeting, I was requesting them everybody to pick a condom as they go home. So they just came out and told me, no, we don't use these things. Initially, during the meeting, I was taking them through the U is equal to U. Then they told me, this thing has been working practically 7 years ago. So your science has started working now. Because they told me they don't use condom. All they do is the positive one, take drugs, get suppressed, we are couples. So I think it's upon us to put this information out. It's not out there. At the facility level, I do get sometimes couples being sent to the facility from the religious institutions. Go get your HIV status notification and bring to us so that you can proceed and do what? And wed. When one partner turns positive, definitely you know what will happen. This will turn out like it won't go ahead. So it's all about sensitization. Let's teach them what this U is equal to U. For example, at my facility, I guess U is equal to U is working more than even the PrEP. They're not taking PrEP now. They are concentrating on U is equal to U. So let's put the information out.
Thank you, very important. Number 4.
Thank you. My name is Tendai Westerhoff from the Pan-African Positive Women's Coalition in Zimbabwe. I have issues with the U equals to U. Personally, I'm now an empowered woman who knows what it is when somebody says U equals to U. But we are getting a lot of cases of people who are newly diagnosed with HIV, and from the communities that I come from, Sometimes the viral load testing machines are not there. A person gets tested for HIV for the first time and they are put on treatment because our policy in our country is test and treat. But they never get a chance to get the viral load test. So in scenarios like that, how then do we determine that U equals to U can work? How many times in a year should a person get a viral load test? Because for me, I understand that a U equals to U, it's all about the viral load remaining undetectable and unsuppressed. But you can only know that not through the naked eye, but to have regular tests of the viral load tests. And most of our communities need community systems strengthening and the health system strengthening. The viral load testing machines are not there. In the rural areas, they're hard to reach. And a person at the grassroots, they don't even know what U equals to U is. And in the counseling that they get, some are even scared to talk about the U equals to U because they think that maybe people will start to abuse it and go about maybe HIV cases may actually increase. So what are we doing about the health systems strengthening to ensure that viral load testing machines are available and people living with HIV in different communities know the importance of having these viral load tests more often, not just once when you are U equals to U, because a U equals to U situation, it's not permanent. It can change anytime. Thank you.
Thank you very much. Quite a lot to unpick there. I'll do my best to address some of the things. So absolutely, this is a really, really important issue, the issue of health systems strengthening. And one of the things that Michelle talked about when she was talking about the WHO policy was exactly that. When people started to talk about U equals U, it was really based on places where plasma viral load testing was done. And we know that across the world, there are many, many countries who don't do plasma-based viral load testing. And so immediately there was an inequity between people who lived in countries where you could have plasma-based testing and countries where you couldn't. And so somebody mentioned this earlier, U equals U has often been perceived to be something that only rich people or people who live in rich countries can aspire to. But techniques like dried blood spot testing, which is cheap, doesn't require infrastructure, just requires a piece of blotting paper that you do a finger prick and put your finger on, and then it gets sent away to be analyzed later, is just as effective a way of detecting viral loads as plasma-based testing. But people, I think, oh, plasma-based testing is the gold standard. But WHO has done lots of tests on dried blood spots, showing that if you use a WHO-endorsed test, undetectable is the same with those plasma-based tests as with dried blood spot testing. So countries that don't have access to plasma-based testing, in my view, should be exploring technologies like dried blood spot testing. So your point is really well made. I don't know if any of you want to comment.
From my side, Nika, I think that the point that has just been made is very much relevant to Africa, because we do deal with a lot of areas that are resource limited areas. So when we do talk U equals U, how does that apply when we're dealing with resource limited settings? Thank you.
2, 1, 1. Okay.
Thank you very much. Thank you very much. I hope you can hear me. Can you?
No, sorry, not clearly.
All right. So my name is Joshua Nyolo. I work for LBCT Health. I've been working in the community on preventing violence or ending violence against women and its connection to HIV for quite some time. And one thing that I've realized is that information, giving people information is good, but does not necessarily mean that those people will change. So the best way to help such a program like this one is a wonderful one. Information on U equals U is to have interventions or programs that will help people see the need, and where we are coming from, so that it doesn't become like we are, people who are HIV positive, we are pushing ourselves to, or trying to justify
that you can reach a point where you cannot transmit HIV. So in our messaging, I think it's very important for us to do that. The other thing is that someone talked about gender-based violence, which is part of the work that I do. And for sure, the issue, men for a long time, because when we go to the communities, many times we discuss issues of GBV, and women tell us, yes, we have that information. We are not the ones who perpetrate us, and men are the perpetrators. Please, can you talk to our men, you know? So we need really to see how we need to bring men on board, and including religious leaders. Most of our communities, the religious leaders are men. That's why they ask for, when you need to marry, they will ask for an HIV test. And they never know that you can even marry a discordant person, you become undetectable, and then you marry. You know, I've seen it even happen in the church that I go. I feel so much discouraged because I am powerless to tell the religious leader what you are doing is very wrong. By the way, I don't know who gave them that particular power. I don't know whether it's the law which says that. I'm not sure. Someone may need to clarify to us. But it's really illegal that the pastor can tell you because you're HIV positive, you can't marry this HIV negative person. It's very, very wrong. So I would say that we really need to see how we package our information, because information does not mean change, but the need, when people see the need to change, they will change. Thank you.
Thank you very much. So I'm going to go to 2, to 4, to 3, and then there's another hand up in the middle.
Thank you. I'll try and be brief. The colleague that spoke just before this last speaker partly covered me. I come from a district that is probably the hardest hit in the world, and I think the importance of going back to basics is critical. When we first started rolling out treatment, we spent time. We spent time on counseling, on support groups, on education, and we threw that out the window when we said test and treat. We're just rushing. A lot of our patients don't even know what viral load is. People that are taking antiretroviral treatment don't understand. The language of CD4 is something that was spoken about, but the virus is not spoken about. So I think that is something that is very important. Going back to those basics, when we're supporting people, is spending time, understanding that this is a long journey. This is something that requires time and people to understand exactly why they're taking treatment. Then the message of U equals U, I think, might probably be even simpler to unpack.
Thank you. Thank you very much. Number 4.
Well, good evening. My name is Maurice Were from HF Kenya. With me, U equals to U is a game changer, just as some other speakers have said before, because I believe that for us to achieve our goal of ending HIV by 2030, we must package the message of U equals to U and bring it out clearly to the community, more so the HIV negative population. Having said that, I work with young people, AGYW, and teenagers. And U equal to U has opened another Pandora's box to the youths, in that they know and they believe that they can't transmit HIV to their sexual partners, forgetting that being virally suppressed does not necessarily mean that they won't get early pregnancies, they won't get sexually transmitted infections and such like things. So we deal with different cases every now and then. Even right now as we are speaking, we have very many empowered young girls in our facility who are seeking antenatal care at the age of 18 years, at the age of 17, at the age of 20, school-going girls. Why? Because they know and they believe that U equals to U is working, and they don't care much because they can't transmit HIV. But at the end of the day, they end up losing because when they get early pregnancies, they drop out of school, they become mothers. When they get STIs, they might end up getting even HPVs. So I think we should again package this message very well to our young people, because in that age group, we are also having high number of new HIV infection, meaning they're having unprotected sex. So if we don't package this message well and sensitize our youth and young girls more so on the importance of use of condoms and other protective measures apart from U equals to U, I think we will be losing at the end of the day. Thank you.
Thank you very much. And I think we're going to have to end on that note because we have just over a minute left. But I'd like to say thank you to everybody. And if you do have questions afterwards, maybe come and talk to people in the room and maybe we can address some of those questions. But I'm going to hand over to Sib now for some closing remarks. Thank you.
I must say the insights gained, the conversation, the in-depth discussion, truly, truly grateful for the conversations and the you know, transparency in how we really think about U equals U. And this has left myself personally, and possibly very likely the rest of the VIV team, even in the audience, thinking, what next? Definitely there is more that needs to be on the table around the discussion of U equals U. And I am going to ask our head of clinical operations, who is our vice president, Annemiek, if you can stand up and commit that VIV is saying we are committing to something more.
Do you want this?
Or to do more.
Thank you for that surprise, Sib. I think as VP Head of Global Medical Sciences at VIV, first of all, I just want to congratulate you all for an amazing symposium, and thank you to the audience for taking part. VIV is committed to people living with HIV and people who could benefit from PrEP as well. We haven't had a lot of time to talk about that. But we are also always committed to looking further at what we can do and what we can do in this very important field. It is a company that focuses solely on HIV, and we will continue to do so. We sponsored this meeting for a good reason, because we believe in this. We held this symposium because we believe in this, and we will continue to do what we believe in for the benefit of everyone. Thanks.
Thank you, Annemiek. Can everybody lift their bottle of water? And we're actually going to say cheers. As I say the last closing remark, which was actually decided upon by Doreen. The closing remark for the session is, U equals U is everybody's business. Cheers to that. Thank you.